I'm Dr. Stephanie Alm. I've recently moved back to Caldwell County, where I grew up and where my family is native to for many, many years, and to partner with Lenoir Family Medicine. I grew up here and actually grew up as part of this practice when I was a young child, so I'm very familiar with this practice. I grew up in the school system here. Went to Laurel Creek Elementary, then William Lenoir Middle School, and then went out to West Caldwell High School, go Warriors. Then went on to North Carolina State University as a Park Scholar out there. Graduated with 2 degrees in biological sciences and applied mathematics. I also did a minor in piano while I was there, and enjoy still playing piano when I can and being part of the music program at First Methodist Church here in Lenoir. I then did my medical degree at University of North Carolina, Chapel Hill, and then moved to Greensboro for my residency training at Coden Hospital. Then practiced again in Greensboro for about 2 years before I decided that it's hard to be away from family and moved back to this area. I think the whole family dynamic plays a part into the medical health of the patient. So I like to get to know you both from your medical standpoint, but also how is your family doing, what do you do for a living, all these sorts of things, because if those things are not going well, your health is not going to be going well. And so I like to know those things about you. I do like to see the whole family unit. I like to see young children, I like to see adolescents, I like to see women and men, I like to see the elderly. I like to see the whole family. In family medicine, we like to laugh and say from womb to tomb, but it truly is the case. I think we play a big part in preventative medicine and making sure we stay up to date on many things. Staying up to date on immunizations and staying up to date on our cancer screens and staying up to date on these sorts of things. I like to stay up to date on women's health is one of my particular interests, and contraceptive management and things of this nature. I have a particular interest in women's health and routine screens for women and Pap tests, and for example, and have some special training in various contraceptive management, such as IUDs and the newer forms of birth control, such as the Nexplanon. So I think it's important that we can be empowered and stay ahead of the game rather than chasing things such as diabetes or high blood pressure or high cholesterol. It's a shame that we always get behind on some of these things when in fact many times these things can be prevented. It's such a beautiful area with the mountains. You know, I remember driving home from school and driving home from Greensboro to visit family, and you're driving home on 421 and you hit this area and you first see the mountains, and it's kind of like this breath of fresh air when you see the mountains, and it's like, oh, I'm home finally. And then you get around family and you know you're home. So it's such a lovely place. And then you get home and everybody knows you, you know, and they all know how you're doing and how your family's doing, and they ask questions, you know, how's so-and-so's health and how are the kids and things like that. And you miss that in a bigger city, and in a small town like Caldwell County and Lenoir in particular, you get that, and I miss that in a bigger town. So it's nice to be home and be a part of that again.